Hello guys, this is Crystal Townsend, and this is my final PowerPoint presentation for Nursing 447. I decided to do my project on chemotherapy education. Mainly I want to talk about how important chemotherapy education is and how our current process is and how I feel like we can possibly change our process to make it better. So this is something I deal with on a daily basis, and so what normally happens is when the patient comes in to see us on the day of diagnosis, they're experiencing all kinds of feelings. They're given so much information on that day. First of all, they're being told for sure the scans came back and it shows you have stage 3 lung cancer. That in itself is enough information. That's all that you want to hear. After that, a lot of people's brains just shuts down. They're given so much more information besides that. That the question comes up: is this the best time to educate the patient about the chemotherapy that they'll be receiving? Who is responsible for educating these patients? It's a team effort as far as education goes. The physician talks to the patients about the chemotherapy, but the oncology nurse is responsible for most of the patient and family's education. So on this slide, I kind of talked again about the day of diagnosis. They're told about additional tests that needs to be done. Typically, we need to get a PET scan to see if the cancer is anywhere else. So they're given that information. They're told about those appointments. They're told about whether or not radiation is going to be an option, if they're going to need surgeries, whether or not they want to have chemotherapy. And then they start discussing about the protocols for the chemotherapies, which is so confusing. So a lot of times by the time the patients come in to us to receive their chemo, they're not sure how many times a week they're going to have to come, how many times they're going to have to get it. Not to mention the side effects of the chemos. I mean, they're still confused on how many treatments they have to have and how often they have to come see us. So we have to also clarify that on the day of their first treatment. So what does the patient need to know? Patient typically will give them the names of the medications. They need to know what drugs they're going to be getting, how often they'll be getting the therapy, side effects of the drugs, how to deal with the side effects of these drugs, and if there's a way that you can prevent these drugs. They need to know who to call and when to call them, what side effects to report, what issues is considered an emergency that they need to go to the emergency room for. All of that information is very important for them to know. So our current process, according to the literature that I've read, it states that the patient should be educated on chemotherapy prior to their first treatment or during their first treatment in an individual session with the primary nurse. That is typically how we do this. On the day of their first treatment, we bring them in. We sit down with them. We have a packet ready for them. It has printouts on every chemotherapy drug that they'll be receiving. It lists the side effects, most common side effects, what to report, what to avoid while they're taking these drugs. We go over how often they'll be coming in. We go over the regimens, how many times they're going to have to come in, when they'll have their next scans. We give them all of this education that day. And then after we go over all of this, we get them to sign their consent form. So the question that I have always asked myself since I have been an oncology nurse is this the best way? That's the reason I did this project on chemotherapy education. It's because I've always wanted to change our protocol for education. We haven't done that yet, but this is a good step forward to changing our process because I personally do not believe this is the best way to do it. Typically, when educating a patient on their chemotherapy, it takes at least 20 minutes. It can take longer than that. You have some people who are very well educated. They understand what you're saying. They want to know every single detail. You have some patients who says, I don't want to know anything. If I start having any problems, I'll read the paper or I'll call. So it depends, but you're looking at least 20 minutes that you need to spend with these patients on the education process. I personally believe that they should have a family member with them while they're being educated. We always allowed one family member to come into the chemotherapy room with the patient. But since COVID, we do not allow any family members in there. So when we're educating these patients, they're alone. Nobody else hears the information. The patients get the packet that we have ready for them with all the printouts, but a lot of times they're there for their first treatment. They're anxious. They don't retain a lot of this information. One of the articles that I read had a statement regarding standardized education process. It talked about how a standardized education process is linked to improved patient satisfaction, increased knowledge of side effects related to chemotherapy, and increased efficiency of nursing staff regarding time and quality of care provided to patients. And all of these are very important. With a standardized chemotherapy education, what the plan that I would have to move forward with changing our process is I would like to have a checklist. Have a checklist of every single thing that I needed to go over with the patient. And once I went through this, then we would check it off and we would know that we have covered every single thing. Every patient would get the same education. Simplify the education materials. We have some printouts already made, but some of them are very wordy. They're hard to understand. So I would like to simplify that and maybe even have a video made of regarding basic chemotherapy education. The video would be a generic video as far as, what to expect when you're taking chemotherapy. A lot of the drugs have the same side effects. There's some drugs that have specific ones that are important to the patients to know when they're receiving it. But as far as just overall chemotherapy, as far as what to expect, a video would be good to have. Another article I read talked about doing a group session. They would bring in 25 to 30 patients, have a group session of education. I don't feel like that would be feasible for us. We may have 1 or 2 new starts per week. You wouldn't want those 2 patients to wait until you have enough to do a group session. They've got to be educated before their chemo. Also, I feel like the more people you have in the room during a group session, the harder it would be to actually educate. I think one-on-one is still the best way to go. Barriers to our current way of educating patients. Rising patient volumes makes it difficult to provide the time needed. We start with the patient educating them. We get busy, you're trying to rush through it. Tell them, to hit the high spots, get the consent signed, and you're off and ready to go. And that is not the way it should be done. More time should be spent with these patients. Also, the patient's very anxious when they come in for their first treatment. So giving the patient this much information right before they get their chemotherapy only increases their anxiety most of the time. They have anticipatory nausea. They've read, numerous things about chemotherapy. A lot of these patients are nauseous before they come in. Just thinking about what they're going to have to do. They have in their mind that they're going to get sick, so they're already nauseated before they come in. It's not a very good time to educate these patients when they're not feeling good. Excuse me. Also, lack of privacy. We have an open chemotherapy infusion center. So when we're talking to these patients, we're in a room where you have, 8 or 9, 10 other people in the room. So you don't really have any privacy. And a lot of these side effects, especially when it comes to infertility and how it's going to affect their sex drive, people are embarrassed to talk about those topics, and so you really don't want to get into those conversations when you have more people in the room that can hear the conversation. Providing proper education can cut down on nurse calls. We have lots of calls coming into the back office from patients who have received chemo, and they either don't remember how to take their nausea medicines, or they're calling about a side effect, or they can't remember what the nurse told them. So they have questions about that. The back office nurses have to come and talk to us, and then they have to call the patients back. So there's a lot of kind of back and forth. But I did read in one article that specified that they had a study on nurse calls, and this specific cancer center had received 168 nurse calls. 139 were related to symptom management. There was 6 questions about how to take their medications, and there was 21 questions about when their next appointment was. So all of that information should be given in their education time. And so a lot of these patients, a lot of these questions could be answered beforehand if the proper time was spent. Also, follow-up phone calls. I want to implement a follow-up phone call from a chemotherapy nurse within the next 2 days of chemotherapy. I think that would alleviate a lot of these nurse calls to the back office. The other thing I'm going to have a meeting with our physician or nurse practitioner about is palliative care. All the education that I have done since I've been doing my BSN degree, pretty much all of it has been on cancer and chemotherapy. A lot of the information is about palliative care, and I have read that every patient that's diagnosed with cancer should be referred to palliative care as soon as they're diagnosed. Palliative care is not hospice, so again, it's an education thing with these patients. You can have palliative care and still do aggressive treatment, so you can still have chemotherapy with palliative care. Palliative care focuses on the patient's symptoms, so these patients would have a nurse or a nurse practitioner coming to their home to check on them. So it's kind of like home health. They would come in, they'd see the patients in their home. A lot of these patients that have palliative care get real close to their palliative care team, and they can tell them things that they don't feel comfortable telling a physician that they might see once a month. They see their chemotherapy nurses more than they see the physician. Same thing with these palliative care practices. They see these physicians and nurses more, so they get comfortable with them. And so what happens with palliative care is the palliative care nurses and nurse practitioners actually phone our office and talk with the nurse practitioner or physician about how the patient's doing. So a lot of these phone calls that are coming into the office from patients, I feel like they would be alleviated if the patient is having a nurse or a nurse practitioner see them at home. Also, I think it would give the patient a sense of, somebody really is concerned about me. They care about me. They're coming to my home to check on me. So again, this is a very important subject matter that I feel like I need to address with my office. Every patient needs this type of care. So at the end of the day, I want my patients to be treated like I would want to be treated. I have felt like since I've been a chemotherapy nurse that there's always something to learn. I mean, we're always learning new things. I like to share with my patients stories that I have heard from other patients, regarding the same issues. If a patient's told me that something's worked for them, I like to make a note of that and I pass that on to other patients. So I just want to do everything I can for my oncology patients, and I feel like education is a big piece of that. So I feel like we need to do a better job of educating these patients. The last slide is just my references. So that's the end of my PowerPoint, and I hope you enjoyed it. Thank you.